Okay, so this segment is brought to you in partnership with Medicare Advantage Majority, and I want to welcome the spokesperson for all that, Darren Grubb. How are you, sir?
I'm doing great. Great to be with you, gentlemen.
Yeah, it's great to be with you too. So I understand that, listen, you spend an inordinate amount of time making sure that seniors are getting the kind of coverage that they're looking for.
Yeah,
Tell us a little bit about what you're up to.
yeah. Medicare Advantage Majority. We are a nonpartisan, nonprofit organization representing the 35 million American seniors and people with disabilities around the country who are on Medicare Advantage. And our job is to help protect and strengthen the program. We represent a grassroots coalition of local advocates nationwide, powered by these advocates, including beneficiaries and caregivers and healthcare providers and community leaders. Really, the entire caregiving ecosystem is kind of how we come at it. And for those who don't know, the appeal of Medicare Advantage, the program, is that it delivers comprehensive, high quality, affordable care that goes beyond traditional fee for service Medicare, which is exactly what it sounds like. Every time you need a service, you pay a fee. And so Medicare Advantage offers, benefits including dental coverage, hearing, vision, in-home care, and it includes prescription drug coverage and an annual cap on out-of-pocket costs, which is significant for seniors on a fixed income, and particularly in times like these where we're still, trying to get a handle on the inflationary environment.
Yeah, I remember this was quite a popular program. Was
Yeah.
this part of '03 Medicare, or was this before that?
Yeah, that's about right. That timing is about right. So it's been around for quite a while. It's over half of all eligible beneficiaries for Medicare are on Medicare Advantage. They choose Medicare Advantage, and so it's quite popular, and enrollment is high. Satisfaction is very high too.
I
And
remember.
it's been around for 20 years, and a lot
Yeah.
of people have come to rely on it, and it hasn't been without its share of opponents. And I've never understood why politicians would oppose extra benefits for people who need them. And I know that your group has been at the forefront of protecting everybody's access to those.
We have been in the most recent fight, as you guys know, was during the budget reconciliation process, where we worked with our network of grassroots, coalition around the country to help rally seniors in opposition to any potential funding cuts that were considered. And the hinge point on the Senate side, several members floated the idea of including provisions of a bill called the No Upcode Act, which would, undermine critical elements of that Medicare Advantage program and essentially cut funding. And so we mobilized seniors, around the country who reached out to their members of Congress, writing letters and making phone calls and showing up at town halls and to make their voices heard. They also spoke to local media to make their voices heard. And on top of that, in addition, MAM launched a 7-figure TV and digital campaign to help elevate and amplify those efforts in DC, but also in key markets around the country. And taken together, that was a critical element in helping to take Medicare Advantage off the table for reconciliation. But we're going to stay open and engaged.
Yeah, you always have to, no question about it. I remember Medicare Advantage just in my early years in politics. It became a target
Yeah.
for the left in a lot of ways, and they saw supplementary care, and it was divorced from their vision of a single payer healthcare system in a lot of ways, and so the first probably decade of the existence of Medicare Advantage was exclusively attacks off the left, but as it has grown and as it has been adopted, you can see politicians of all stripes try to figure out if there's revenue in there, which is, I'm sure, what it is that you all are working on a day-to-day basis.
That's right. And look, I mean, given the environment we're in, the kind of the cost-cutting environment, which we understand. Look, we understand the desire, in many cases, the need to cut costs in the federal government. Our viewpoint, and which we've made clear, is that it cannot be done on the backs of seniors or the health care that they and their families rely on. Using seniors' health care as a pay for is bad policy, and it's really bad politics. Funding cuts to Medicare Advantage would pass billions of costs onto seniors. They're going to pay higher deductibles. They're going to have higher premiums. They're going to have higher out-of-pocket costs, and they're going to have less access to the doctors and services and benefits that they need. And so, in particular, cuts to Medicare Advantage would have, a profound impact, an outsized impact on groups that need it most. So those living in a rural community, or veterans, or seniors with chronic conditions, low-income seniors. Here's the bottom line as we see it. President Trump campaigned on protecting and strengthening Medicare. Any effort by Congress to cut funding would be counter to what President Trump has promised the American people and the seniors.
Yeah, and Darren, we are 13 months out from a midterm election. Seniors are a huge voting bloc and a huge determining factor in which party will succeed in that election. And I got to imagine that you guys are working overtime to make sure they're aware of everything that is affecting them right now.
We are in 2024, nearly 40 million seniors turned out to vote. That was the highest turnout of any age group. And the president's own pollster, Tony Fabrizio, who you guys know, he's called this voting bloc, the deciders. They decide elections. And I think Republicans should be mindful of what Fabrizio said, what poor messaging on both Medicare and Social Security in 2022 hurt Republicans in some ways. And so, protecting Medicare Advantage, remains critical policy, but it's central to any credible electoral strategy. And the Democrats know this too. When the no up code provision was introduced or considered being included in the reconciliation, the Democrats fundraised off it. The Democratic Party and the DSCC sent out fundraising emails because they know, that this is a third rail of American politics. And so, that's what we're trying to make clear to all members of Congress.
So for folks who are either enrolled in this kind of thing or close to being enrolled in Medicare Advantage, what are the upcoming fights that we're talking about? You clearly crossed a major barrier during the Big Beauty. But like now that we're into the fall, we're dealing with government shutdowns. What's the next fight as you see it?
Well, we're on guard because despite high satisfaction rates, record enrollment, Medicare Advantage was cut several times by the previous administration. And again, President Trump campaigned on protecting and strengthening the program. We feel that members of Congress should focus on ways to improve and expand access to the program. But we're going to make sure that seniors stay engaged. And
what is it about? This has always been confusing to me, Darren. What is it about the sort of progressive left? What progressive left argument do they have against Medicare Advantage? I mean, they are for entirely single payer, entire government run healthcare in many ways. But Medicare Advantage has always been a target. Why?
I'm not going to speak for them. I will tell you that. But here's the bottom line: these are critical programs that support seniors at every income level and every tax bracket. In some cases, it's the only zero premium insurance product available to meet their needs. And so, our polling has shown that 86% of beneficiaries are less likely to vote for a member of Congress, Republican or Democrat, who supports cuts to Medicare Advantage. And so, back to our earlier conversation, seniors are a critical voting bloc. They show up reliably, and what is promised to them should be honored and kept.
Yeah. Yeah, it is stunning. I think your question, Josh, is one that I've never really understood. I mean, back to when I was just starting in politics at the time that this program was being discussed and then rolled out, and I never understood the opposition to it, because what you're talking about is more service, more benefits to people who need it. And for the life of me, I have never, ever understood why anybody would oppose something like that. And I know that there's been so much effort, so much learned over the last 20 years in administering the program, and there are so many people who have come to rely on it.
Yeah, and look, seniors, choice is a big part of the Medicare program as a whole. And every year, seniors have the choice between a Medicare Advantage program or a traditional Medicare Advantage program, based on their needs and circumstances. And so, the fact that the supplemental benefits that come with Medicare Advantage is really, all the best parts of Medicare rolled into one, with the prescription drug benefit and the cap on out-of-pocket costs. The numbers speak for themselves, in terms of how many people are enrolled. Again, over half of all eligible beneficiaries choose Medicare Advantage.
That's a huge number.
Yeah, huge number. So,
and I got to imagine. I mean, look, you've been a White House spokesperson. You've been involved in previous administrations, and I got to imagine seeing the evolution of Medicare in this day and age, the overwhelming popularity. That's probably why you're involved in all of this, and that you're trying to do what you're doing.
Yeah.
But just describe to me what you've seen here over the last 15, 20 years in terms of both the political potency and then the overwhelming popularity of what you're involved in here.
Well, let me tell you what, I think I could probably answer both by sharing why it resonates with me. And so, I'm a little bit older than you gentlemen, but, I'm a member of the sandwich generation. Mm-hmm. So my wife and I have 2 young kids to take care of at home, but we also have aging parents and aging family members who need more medical care and attention than they did even a few years ago. And so, the fact that Medicare Advantage provides the benefits and the comprehensive service and the financial security, predictability, for our aging parents is significant for us as emerging caregivers. And, that is why it resonates with me. But, I'm, creeping my way toward being eligible myself. One what we say, as you are too. And so, what we say is that, what happens now in terms of protecting and strengthening this program matters not only to those who are currently eligible, but those who are in the pipeline, those who are 5-10 years out. And so we want to protect and secure Medicare Advantage for the horizon. Coming in.
Darren, you mentioned something that caught my attention. Yeah. What happens now if Democrats and the left, it's not all Democrats, some Democrats are supportive of this, but if the left is successful in dismantling this benefit for American seniors, what happens next?
Well, the cost burden will be go straight to the seniors, right? And so the billions of dollars, and the CBO has done some research on this, but it will pass billions in costs onto the seniors. And again, let's not forget, seniors have worked their entire lives. They have paid into this program. This is a benefit that they deserve, the peace of mind and the security knowing that their health care is going to be taken care of, and that they can age gracefully and independently and on their own terms. And again, as I mentioned, there's a family component too, and that's why we represent the entire caregiving ecosystem, including family members and the caregivers and the community leaders who have to deal with this in their communities, rural or urban. And so, it does touch just about everybody. And if it doesn't touch you right now, it will at one point.
Yeah, and Darren's not saying this, I'm saying this, mm-hmm. but you've seen a repetitive pattern where if you create a crisis, mm-hmm. well, you've got to solve the crisis. Mm-hmm. And the solution to the crisis is always way worse than whatever it was that was servicing the community that created the crisis. I mean, am I right? Is that, do you agree with that?
Sounds like you guys have been in politics for a while.
It turns out. But I mean, that's part of the deal. And I look, again, I keep hearkening back to when this was created and the overwhelming popularity of it, and time after time, people coming sort of into the fore to try to figure out a way to dismantle the single most popular. I don't know if polling reflects this, but I remember defending this back in like the early aughts mm-hmm. or the late aughts and early 2010s, where it's like, are you really going to come after the one piece of government here that people appreciate?
Right. No, and look, I mean, it does have pretty broad bipartisan support. It's pretty broad, bipartisan opposition on different elements. And so, the fact that we were able to mobilize seniors, and I think that's that's the political conversation that we should be having, and members who are running for re-election should be considering, is that, a promise was made to seniors to protect and secure and even increase access to the Medicare Advantage program. And seniors got a long memory. They've been around for a long time. They're an important voting bloc for a reason, because they reliably turn up, and they know who kept what promised to them. And so, President Trump has been very clear in his support and was on the campaign trail and brought along a lot of Republicans with him to Congress as a result of promising to protect and strengthen Medicare Advantage. And so, I think the political calculation cannot be overstated in terms of those looking to the midterms and beyond.
Yeah, Darren, on our show, we have a pretty wide range of listeners. We have a significant population of boomers. We had a shirt, Thank a Boomer, just to try to drive some appreciation to the generation that preceded us. I know you're organizing those folks too. And I wonder if you could provide a little bit more info about how people can get involved in what you're doing if they're hearing this and they want to get ready.
You got it. So you can go to our website, which is www.medicareadvantagemajority.org, to learn more about the issue, to learn more about our organization, to learn how to get involved. If you feel so compelled to reach out to your own member of Congress to share your viewpoint, we make it easy. Click a button and you send off an electronic note to your representative. And so, I would encourage people to do that and to learn more about the organization.
Well, thanks for joining us, Darren, and thanks for what you're doing. Darren Grubb, Medicare Advantage Majority Spokesperson. You got the details right there if you want to get involved. Thanks so much for joining us.
Guys, this is like Smartless for the thinking man.
Appreciate it, buddy.
Really enjoy my time. Thanks for having me on.
Thank you.
Take care.